Why does my lower back hurt when I wake up? If you ever wake up in the morning with back pain, backache, and you're wondering why your lower back hurts when you wake up, this video is for you. Not only am I going to go over 3 little known reasons why your back could be hurting in the morning when you're waking up, but I'm also going to give you 3 action steps, 3 things you can do to actually help minimize that and make it better. So do watch right to the end. Hi there, I'm Dr. Walter Salubra. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving you tips and strategies on how to strengthen and stabilize your back, as well as how to correct spinal distortions with corrective chiropractic care. Like this, you can bend, move, and lift normally without pain limitation and do the things you want to do in life happily and normally. If you want these tips and strategies, be sure to subscribe today by clicking on that red button below, tap on the notification bell, turn on the notifications on your mobile devices, the YouTube notifications. Like this, you don't miss out on my weekly video updates. Now, other than common reasons why your back may be hurting in the morning when you wake up, like a bad sleep position, being distorted in your sleep, or maybe an old, bad mattress that needs to be replaced, we're not going to dive into those. Those are pretty common and most people understand that. I want to give you 3 little known reasons why your back may be hurting in the morning when you wake up. Number 1, there could be inflammation in the spinal joints or supporting structures, including the discs. Now, you may not know that there's inflammation because there can be inflammation deep into the spinal tissues, into the tendons, the ligaments, the discs, the spinal supporting structures, the muscle attachments to the actual structures of the spine. And maybe don't get stressed until you take them through a specific movement or motion at the end range. At nighttime, you could be resting comfortably. You had a long day the day before, maybe sitting all day, standing all day, doing different movements throughout your day-to-day movements and activities. But then you go to bed feeling great, and all of a sudden you wake up in the morning and now your back is stiff and you're tweaking those inflamed tissues that you didn't know you had. So that can be one of the reasons why there is back pain in the morning, or why the lower back hurts when you wake up in the morning. Number 2, disc degeneration or degenerative arthritis. That's that wear and tear arthritic changes that could be present along the spinal joints, the vertebral bodies where the discs attach, or even in the discs themselves, possibly even unknown disc herniations or disc injuries. And again, you may not know you have this without an actual evaluation or a spinal x-ray or an MRI. Like, let's say you never got checked by a chiropractor or a physiotherapist or a doctor. However, it's possible that that could be causing your pain in the morning. You wake up in the morning and now you put pressure on the disc, you put loading pressure, which means body weight when you're sitting and standing, and if the discs are injured, will now cause pain in the morning. Arthritis degeneration stiffens the joints, decreases mobility, makes things tight and stiff. Now you have to wake up and move about and get dressed and so forth. Again, it's going to stress those tissues that are arthritic and trigger pain response in the morning. That could be another reason why the lower back hurts more in the morning when you're waking up. Remember, stay right to the end because I'm going to give you 3 strategies to counteract these little known reasons for why the lower back may be hurting in the morning. Number 3, I already touched on this a little bit when I talked about arthritic changes because it kind of coincides. There could be a disc bulge or a disc herniation. Oftentimes when there's a disc injury in the form of a disc bulge or a disc herniation, there's inflammation in those disc fibers. They're very pain sensitive. They're sensitive to the inflammatory chemicals that are a result of the injury. At nighttime, your body and your spine is relaxed and they're actually drawing in fluid. The discs are imbibing fluid or drawing in fluid, expanding a bit. And now you go put weight-bearing pressure, either seated or standing, and those injured discs that were expanding at night because they're drawing in fluid, which is a normal physiological process, now are being stressed with your body weight and because of gravity and loading pressures on your spine. Then you go move, bend, and twist, and get dressed and go through your daily activities in the morning, and you'll see that you're actually having more pain in the morning. It's something I see very commonly amongst my disc bulge and disc herniation patients. They tell me they have more pain in the morning because of that. So what do? What are the 3 strategies that you can do to help reduce that or make this better for you when you wake up in the morning? Number 1, do get an actual spinal assessment and evaluation. One of the best ways to do that is with a chiropractor or a corrective care chiropractor. That's what we do all day long in our office. We check people's spines and we check people's postures. We do an x-ray evaluation and we're looking for these signs of either degenerative arthritis or disc degeneration or inflammation on those supporting structures of the spine. Because now, when you know what the alignment problems of the spine are doing, then you now have a way to determine how to fix them with corrective techniques and methods. And remember, non-surgically. So do get an actual spinal evaluation with a chiropractor. Make sure they're looking at your posture and also an x-ray of your full spine from front to side to see exactly what your spine looks like and where the problem areas may be. Number 2, narrow down and see which structures are inflamed. Again, an evaluation will help that. Once you determine that, then now you have an actual starting point to begin to correct it either through corrective techniques or exercise. And number 3, talking about exercise, you can do some light stretching in the evening before you go to bed and also some mobility work on your lower back before you go to bed. As well, do the same stretches and mobility work when you wake up in the morning. What that does is it'll get your muscles and your tendons stretched out and get your joints lubricated and mobilized before you go to bed. Kind of get things settling properly and getting them nice and mobile before you go to bed. That will help with that restriction, the degeneration, any disc irritations, any inflammation. And you can do those same things in the morning, because in the morning you may feel more stiff, more achy. Do those light stretches and mobility work in your lower back to loosen things up before you actually start your day. And I have a great video to show you 4 exercises that can be done in the evening and also in the morning, not just for disc injuries and disc bulges, but also for general back pain and back aches. So go ahead and watch that video right now to help reduce some of that achiness and hurt in the morning when you wake up.